Hi, I'm Dr. Kristen Sato here at UC Davis Student Health Center. Today I'm going to be talking about the IUDs, the insertions, the risks, and the procedure. So IUDs are intrauterine devices, and they are the most effective form of contraception that we have. They are over 99% effective to prevent pregnancy. They are also known as LARCs, L-A-R-C, or long-acting reversible contraceptives. There are two types of intrauterine devices, hormonal and non-hormonal. The non-hormonal IUD is also known as the Paragard IUD. It is copper, and it can stay in the uterus for up to 10 years to help prevent pregnancy. It acts as a foreign body to prevent implantation in the uterus. Because there are no hormones in the Paragard, it will not upset the regularity of your period. So whatever your period is before will be how regularly you have your period after you get the copper IUD. It may cause heavier bleeding and increase in cramping and potentially a longer period. These things may last or they may resolve after several months. The hormonal IUDs that we have available here at the Student Health Center are the Mirena and Kyleena IUDs. They both have such small amounts of progesterone in them that the thought is that they stay just down in the uterus, and very small amounts may circulate in the bloodstream. Both are options for individuals who for some reason may not be able to use estrogen-based birth controls, such as people who have migraines with aura. Mirena is especially ideal for women who have crampy or heavy periods. The Mirena and Kyla are both 5-year IUDs. They work as a foreign body in the uterus and also by thickening the cervical mucus and suppressing ovulation. Mirena is the same size as the Paragard IUD. Kyleena is just a little bit smaller than the Mirena IUD and also has a smaller amount of hormone. It is also a 5-year IUD, and in terms of the size, it is 1 millimeter smaller off the bottom and 1 millimeter off of the wingspan. The risks of the IUD insertion include cramping. So you will be pretty uncomfortable in terms of cramping for about 1 to 2 minutes during the insertion of the IUD. It will get progressively better even before you leave your appointment, but may last for several days to even a couple of weeks. Most of the time, the cramping will resolve after like the first couple of days. You can always take ibuprofen or Tylenol to help out with the cramping. Bleeding, you should expect to spot for 1 to 3 months after the insertion. Infection, this is a sterile technique, and so the risks of infection are very low, but we do check a gonorrhea and chlamydia test either at the time of insertion or just prior to the insertion to make sure that we're not introducing any bacteria up and into the sterile space of your uterus. Expulsion, this means that your IUD could come out or partially come out. Embedment of the IUD into your uterine lining. We don't usually find out about this until we're trying to take your IUD out, and it's a little bit difficult to take out, but needless to say, it does not have any implications for your future fertility. Perforation or poking a hole in your uterus, very, very rare potential for that. Pregnancy, this rate is very low, but if it does happen, there is a slight increased risk of ectopic pregnancy, and that means that the pregnancy is not within the uterus, it's usually within the fallopian tubes or elsewhere. This is not consistent with a normal pregnancy if it's an ectopic pregnancy, and you should seek medical attention right away if you do have a positive pregnancy test. How do you prepare for your IUD insertion appointment? You do need to be using consistent contraception for at least the 2 weeks prior to the insertion. So what that means is if you are having penile vaginal intercourse with your partner, that you are using condoms or birth control pills or some other type of hormonal contraception for at least the 2 weeks prior to your insertion. This is very, very important because we don't want to do your insertion at any point in time when you're in the process of getting pregnant. You may choose to take a medication called misoprostol. This is a medication that we recommend placing in the vagina 8 to 12 hours prior to your insertion. And the way that it works is by softening up the cervix or the bottom part of the uterus in order to help it relax and for us to be able to more easily access your uterus. We recommend taking ibuprofen prior to your appointment, 600 or 800 milligrams at one time with a little bit of food will help significantly with the cramping. You can also repeat this dose about 6 to 8 hours after your insertion to help with the cramping. We will perform a pregnancy test at the time that you arrive, so be ready to give us a urine sample. You may also get testing for gonorrhea and chlamydia at the time of your insertion if you haven't had a test in the past 6 months or if you've had a new partner since your last test. You may bring someone along with you. They may either sit in the lobby or come in the room. It just totally depends on what you feel comfortable with. You may ride your bike or walk home. There are no restrictions to any of that after you leave. So the insertion. Your provider will go over the consent form and answer any additional questions that you may have prior to the procedure. You will put your feet up in the stirrups that are provided and have a pelvic exam performed. So this includes 2 fingers into the vagina to feel for the position of your uterus, and then a speculum will be inserted into the vagina. You will have cramping discomfort for about 1 to 2 minutes while your doctor places the IUD in your uterus. This is pretty uncomfortable and can feel like a bad period cramp. And your cramping, again, should be the worst while you're here in the office during the procedure and will get even progressively better by the time you leave your appointment. After the insertion, your doctor will review with you how to do a string check and make sure that your IUD is in place. You may take ibuprofen or Tylenol before the procedure and then again afterwards to help out with the cramping. Some women also use a heating pad. You will probably have spotting after your insertion and likely intermittently for the next several months, particularly with the hormonal IUDs. You will come back to Student Health Center for a string check appointment, usually about 4 to 6 weeks after the placement. This is a quick checkup with a pelvic exam just to ensure that everything is going okay for you with your IUD and that your strings are in place, and to answer any additional questions that you may have. We recommend that you don't put anything in the vagina for the next several days after your IUD insertion because you are at a slightly increased risk of infection during that time. We also recommend that you use backup birth control for at least 1 week after getting your IUD, and so this could include continuing on your birth control pills or using condoms. Frequently asked questions. You do not need to be on your period in order to get your IUD. Some people prefer to not be on their period. Some people do prefer to be on their period. Technically, it could make the insertion process a little bit easier, but sometimes schedules do not permit. It doesn't matter to your providers either way. It's whatever you feel comfortable with. You do not have to have had a baby in order to get an IUD inserted. You are not at an increased risk of sexually transmitted infections with an IUD. However, just like birth control pills or other types of hormonal contraception, the IUD will not help to protect you against sexually transmitted infections. Therefore, we still do recommend using protection with your partners and getting regular STI testing done annually or whenever you change partners. IUDs will not affect your fertility. When the IUD is removed, your fertility will be the same as it would have been regardless of having had the IUD or not. There is a very small risk of pregnancy with an IUD, less than 1%. However, because of the probability of irregular bleeding, particularly with the hormonal IUDs like Mirena or Kyleena, it may be hard to know if you are pregnant. We don't recommend taking a monthly pregnancy test or anything like that, but if you feel pregnant, which many of you have not been pregnant before, but if you have like nausea, fatigue, breast tenderness, pelvic pain, anything like that, We do recommend taking a pregnancy test at home, and if it's positive, then you need to be seen right away. There's a small risk of expulsion of your IUD, which means that your IUD could come partially or fully out of your uterus. We do recommend doing monthly string checks, and again, your provider will review those with you at the time of your insertion appointment. You can still use your menstrual cup or Diva cup even if you have an IUD. And if you have any additional questions or concerns, please contact your primary care provider, or you may ask at your insertion appointment.